Last weekend, I had the chance to experience New Zealand healthcare, and after 48 hours in the hospital, it was 100% free. It just completely blows my mind. So today, let's talk about New Zealand healthcare and why it's so different from the US and why that's so important. We were visiting Whangarei in the North Island over the holiday weekend, and it's something we do about 3 times a year because we just love it up there. There's always something interesting to see and do. We usually go to the beach during the day, and then in the evening we go back to the hotel and have dinner. And after dinner, we like to go out again and wander around, but everything's shut at that point, as it usually is in New Zealand. So we don't have much choice. We go downtown to downtown Whangarei, where there's a nice park. We get to look at the Hundertwasser Museum from the exterior. It's a beautiful building. We get to look at the clock museum from the outside. That's nice too. But one of the places we like to go is Putahi Park, which has a slack line as part of the playground for kids. And each year we've been practicing. We're getting a little better. My kid's been able to cross it twice over the last year. I've been able to cross it once. Very proud of myself. And my wife tries it as well. But this time it had been raining, so the slack line was a bit wet, and so was the ground. It was a bit slippery. So when my partner attempted to cross it, she fell. And she landed pretty hard on her shoulder. Immediately, she knew something was wrong, and she said, "I think I broke my arm." And sure enough, we pull up the sleeve, and her ball socket had come out of her shoulder. She dislocated her shoulder, but she'd also had a compound fracture and was actually bleeding. So it's pretty serious. We called the ambulance right away. It took about 45 minutes for the ambulance to show up, but when it did, that's when things started to get really interesting. First of all, New Zealand ambulances are run by St. John's, which is a non-profit that's somewhat supported by the state, but mostly funded by private donations, including I've donated to them, and I encourage everyone else to do so as well. And an ambulance ride costs just $125. But when it's part of an accident, like it was for us, it was free. Compare that to an ambulance ride in the US. That starts at $1,385 as the base rate, and then they charge you per mile to get to the hospital in addition to that. Depending on what state you're in, the insurance may or may not cover it. In New York, where we lived, we experienced this between the copay and the other 20%. We spent about $500 out of pocket just to pay for an ambulance, versus here in New Zealand where it's $125 and $0 for us in an accident situation. But it can be even weirder because, for example, my son took a tumble in New York and had to use the ambulance to get to the hospital, and we couldn't pay for it out of our health insurance. We had to use car insurance to pay for it. So it gets strange in the US. And New Zealand, at least last weekend, it was completely free. The first thing the paramedics did when they arrived was give my wife a green whistle, which is made famous by Bondi Rescue.
Lifeguards break out the green whistle, a powerful analgesic.
We're going to give you this first, all right? So that'll take a bit of the pain away.
The drug's name is Penthrox. It's a drug that's banned in the US, but it's used in 40 other countries, and it immediately relieves pain. And it works. It worked for her. The ambulance drove her to the hospital, which was luckily only a few blocks away, and my partner was admitted to the ED immediately. That's emergency department, not erectile dysfunction for you Americans listening. When we got to the reception desk, did they ask us for insurance? No. Did they ask us how we were going to pay for it? No. Did they make us fill out a dozen forms just to get in the door? No. Did they ask for my credit card so I could pay for it in advance? No. None of the things that happened in America. No. All they did was ask us for her name and birth date and my name and my phone number so they can get in touch with me. This is already a big difference between the US and New Zealand. When you go to the hospital in the US, the doctors are required to treat you if you have a life-threatening condition, regardless of whether you can pay for it or not. But anything less than that can cause delays while you wait to get into the hospital. As you sort out your insurance plan, your paperwork, you might even have to pay in advance if they're concerned you can't pay for it or you don't have any health insurance. That's literally if you're just bleeding on the floor while you're waiting for the service, because that's what's happened to us in the past in New York, literally just bleeding in the hospital floor, waiting to get admitted into the hospital. In the US, due to privacy concerns, the hospital will not have your access to medical records. your medical records could be spread across wherever you've had treatment. Some of it could be with your regular doctor, some of it could be with the pharmacy, some of it could be with a hospital that maybe you've been treated at before, which means whenever you go to a new location, say an emergency department, they're going to ask you for all of your medical histories. You have to fill out a big form showing any drugs that you're taking, any previous issues that you've had, any kind of allergies you have to drugs, etc. In New Zealand, the medical system has all of this already on file. So when we checked into the hospital, all she needed was my wife's name and date of birth, and everything came up on our computer. All of her previous treatments, any kind of allergies, any kind of medications, all of that was right there in front of the receptionist, right in front of the doctors when they needed it. It was a fantastic use of technology that I can't believe America doesn't have, and I'm really glad this country does. So now we're in the hospital, and we're being swarmed with nurses and doctors. I mean, every 15 minutes, somebody's coming by and saying, "Hi, I'm a doctor. Hi, I'm a nurse. Can you tell me what's wrong? Let's take a look at that." It was great. These people were super sweet, and they were even funny. One nurse introduced herself as, "Hi, I'm one of the many nurses here." And another one said, "Hi, I'm the vampire from the lab here to take your blood." So they set us at ease and kept our spirits up, and I can't tell you how much we appreciated it. Let me pause here a moment and take a moment to acknowledge how lucky we were to get this kind of service at Whangarei Hospital, because some places in New Zealand I know are experiencing a severe shortage of doctors and nurses. There's a hiring shortage of something like 600 nurses, and at Napier's Hospital alone, I heard that there's a shortage of doctors. And at Middlemore Hospital here in Auckland, there are what they call bed blocks, which means there are not enough beds to go around, and people wait hours for treatments just because the services are so overstretched. So I understand at Whangarei we were very well taken care of, and we feel super lucky to have been met with that kind of service at the hospital. Within an hour of being admitted, she had her x-rays and CT scans already and had 3 doctors visit her. And the short version of the story is my wife's arm was broken and pretty serious, and the doctors decided that she would need surgery right away. So we spent the night in the hospital, and she went into surgery the next day around noon. That felt pretty fast. And again, I know it's not fair to compare maybe the US and New Zealand response times, but it felt like we were getting premium care either way, and nowhere along the way had anyone mentioned insurance or the cost. So, of course, as Americans, we were a little bit nervous about that because we were waiting for the penny to drop at some point. Let me show you why. Let's contrast it to the many times I've been in hospital with friends and family in the US and urgent care and experienced that system. I came up with a little system I use whenever I go with anyone to the hospital. I write down every dose of medication, every word the doctor says during their visit, every treatment prescribed, and I keep a note of the time of when these treatments were given. And that's because later on, at some point down the road, you're going to get the bill for all of this. And the insurance company is going to tell you, "Oh, we don't cover this, we don't cover that." And then you're going to read through the bill, and it's extremely detailed. And you'll see the cost of every piece of service that you got and every doctor's bill. It's crazy. It's so Byzantine and so precise. One time I was charged $10 for one pill of ibuprofen in a little paper cup. $10. Ridiculous. And if you think your insurance is going to cover it, well, fat chance, because the insurance companies are doing everything they can to not cover it because that's where they make their fat profit margins. It's a little disappointing. Here's a few examples. Let's say you're traveling and you get hurt and you go to the hospital, very similar to our experience. Well, the hospital that you go to is probably not in the coverage network of the insurance plan that you have from wherever you're from. So the insurance company will say, "Oh, sorry, hospital's out of network, you're not covered." Or worse, the specific doctor you're seeing might not be. I once took someone to the hospital. They had 2 doctors they saw. When we got the bill, we found out that one of them was in network and one of them was out of network. So it was a totally different charge for the second doctor. And since you don't have any control over which doctors come to your bed in the hospital, then you also have no control over how much this is going to cost you while you're in hospital. So back to New Zealand. My wife had major surgery. She got pumped full of God knows how many drugs and antibiotics. She had a titanium plate bolted into her arm on her shoulder. She spent 2 nights in hospital. She was fed several meals, and her vitals were checked by nurses and doctors every hour or so. So a lot of care went into it. And she had at least 15 doctors visit her over the time while she was in the space. So it was a lot of people coming in and out. How much did all of that cost us? $0. That's right, nothing. So when we left the hospital, we felt like we were sneaking away from a dinner table without paying the check. I mean, it was weird because that never happens in America. If you get in an accident in New Zealand, whether it's a car accident or a sporting incident or an injury during a do-it-yourself work at home or a slip and fall, it's covered. This is called ACC in New Zealand. That's the coverage you're under. Best of all, it's way more comprehensive than care in the US. For example, if your accident is going to make it hard for you at home, they'll actually send someone to your house to take care of you, to cook for you, to do your chores, clean the house. I mean, they really, really take care of you, and it's great. So how much would this have cost if we were in the US? Well, my sister, who is no stranger to hospital rooms and hospital bills, said a similar surgery in the US would have cost a minimum of $50,000. And that's just the surgery. With the 2 nights and the other services billing above, it probably would have cost well over that. So would insurance have covered that? Well, they might have covered most of it, but probably only 80% at best. At the end of the day, I'm sure we would have been out of pocket at least $10,000. Now, if you're a Kiwi listening to this, take a breath. Don't panic. The surgery didn't cost the country $50,000. It cost much, much less. And here's why. In the US, a big chunk of what you pay, at least half, is through just one thing: medical malpractice insurance. Doctors get sued all the time. In fact, the reason they get sued is because the healthcare system is so messed up that one of the easiest ways for a patient to recover the costs that they're being billed is to sue the doctor and get the costs back from them that they can then pay their insurance company. Insurance companies keep most of the money this way. Doctors get sued a lot, lawyers get paid a fortune, and you get screwed. That's how the system works. Another big chunk of that pay is the administrative requirements around all of this paperwork. Well, even small doctor's offices have someone, usually multiple someones, to process all of the paperwork that you did when you came in, telling them all of your medical history and keep track of all of that. They also have to keep track of whose insurance has what and which insurance company they need to bill for which treatments. It's a nightmare. That eventually trickles back to a cost to you, the patient. And one trick Americans use to reduce their bills is to negotiate directly with the doctor or hospital. If you're willing to skip the insurance route and just go straight to the doctor and you ask them, look, I don't want to go through insurance for this. What can we work out? Well, big surprise, that doctor bill that might have been $50,000 goes down to around $10,000. And it's not a coincidence, because that's the price it would have cost if there weren't any insurance companies involved at all. So by now, I hope you see what a scam healthcare is in the US, and mostly a way for insurance companies and drug companies to keep their money while you get sicker. But it gets worse, because Kiwis aren't paying $10,000 for their care either. Remember that $10 ibuprofen? In the US, drug companies charge exorbitant fees for even standard drugs and treatments. How ridiculous? Well, last year, AstraZeneca charged $645 for an inhaler for asthma patients, something that people with asthma rely on. Their life literally depends on it. And in the UK, that same AstraZeneca inhaler cost $54. That's 90% less. And that's because the UK has socialized medicine and the US does not. That's the US healthcare system in a nutshell. So the medical companies, software providers, service providers, and everyone else involved in healthcare also boost their rates by 90%. Everyone wants a piece of that action. Here in New Zealand, that inhaler costs about $12. You might have heard the news about that guy in Wisconsin who had to choose between his $500 inhaler and his rent. He chose rent, and a week later he died. But not before spending 3 days in the ICU, which I can tell you was pretty expensive and cost someone a hell of a lot more than it would have been just to buy the inhaler in the first place. And this is how America gets people killed, thinking about corporate profit and favoring it over the actual health of its citizens. No one should have to choose between healthcare and housing. No one. But that's a choice Americans make every day. Medical bills are responsible for 66% of all American bankruptcies. Half of all home foreclosures are in part related to medical bills, and here's how it works, because the system is so broken that you can lose your home if you get sick. Why? If you get sick and lose your job, you also lose your health insurance. And now without health insurance, you can't afford your treatments for your sickness, and you're likely to just avoid the treatments altogether, and as a result, you'll probably end up dead. Not surprisingly, medical bills result in higher medical problems because people break down after losing their homes or when they're freaking out about medical bills. It's a vicious, vicious cycle, and one I am so happy to have escaped. That's how lucky we are to live in New Zealand. It doesn't mean drug treatments are cheap, but you don't have the added costs of insurance, the paperwork, the lawsuits, the price gouging, or the fear of losing your job and then your home, and ultimately even your life. At the end of the day, it isn't just the price of healthcare, but the toll it takes on society. I don't know how anyone can live like that, even though I lived under that system for most of my life, and I don't really understand how it affected me until I moved here to New Zealand. Socialized healthcare changes the way you think about your country, your government, and the people around you. It makes you feel safe. It is such a blessing to go about your day knowing that if something awful happens to you, it won't cost you your job or your house or your life. And it isn't just the dollars either. It means you live in a society that cares about you, that feels that you're important enough for them to pay for and care for. It means that your life matters. This is something that Americans can never seem to understand when they talk about making socialized healthcare in America. I didn't understand it until I moved here and really understood how socialized medicine really changes the society that you live in. It makes me love this country in ways an American can never understand. But it isn't all roses in New Zealand. If you're a Kiwi listening to this, there are improvements to be made. If you think the cost of healthcare here is still too expensive, there is something you can do about it. When I first moved here, I noticed what seemed like a complete lack of public safety. For example, playgrounds have incredibly high places where children can climb, and if they fall, they could get seriously hurt. I talked to people about this when I first moved here, and I said, well, aren't you worried your kids are going to fall and break their arm? And they were like, if the kid falls and breaks their arm, then they get a cast and then it heals, and they learn something from it. It's a valuable experience for them. I thought, well, that kind of tough parenting is great and all, I guess, but there's a cost to that, a dollar cost. And that broken arm wasn't free. It cost the system something. And isn't that a shame when that broken arm could have been prevented by some kind of design in the first place? As I'm walking around Auckland, I see examples of this everywhere. I see tripping hazards everywhere. There are bricks missing in the sidewalk where some repair was done, or someone chopped off a street sign, but didn't bother to chop it down all the way to the pavement, so now there's a rusty piece of metal sticking out of the ground. And this is a disaster waiting to happen. There's a place on Lorne Street in the CBD where someone from the city came and took a tree and planter out of the sidewalk, but just left the hole. I've actually stepped in it and I almost sprained my ankle, but I can imagine I'm not the only one. I don't know how many people have probably stepped in there while they're looking at their phone or drinking their coffee or chatting with their friends, expecting the sidewalk to be flat and then just stepping in this hole and tripping and possibly hurting themselves. So how hard would it have been and how much would it have cost for a guy with a shovel to just fill that in so that doesn't happen? But this is that kind of she'll be right mentality that Kiwis have that's actually costing them quite a bit of money in the long run, and not least of which is through the ACC. ACC spends $6.5 billion every year to cover all these accidents, and I feel like that could be a little bit lower if we just spent enough time caring about preventing accidents in the first place. I'm hoping someone listening to this can point me towards some statistics, because I wonder if anyone is actually keeping track. When we filled out the form at the hospital, we had to write down where the incident happened and what exactly happened. So I imagine there's forms at hospitals all around the country that have this information, and I'm wondering if anyone's using AI to search through these forms and find patterns, or if there's a tech company that's involved in doing this for the government, because those metrics matter. These accidents, they might be minor in nature. They might just cost a few $100s or a few $1,000s for someone to get the care that they need, but it adds up over a country of 5 million people. It adds up over the year. And I would think that a few less broken bones or a few less ambulance rides would mean the difference between someone seeing a doctor and someone who doesn't get to see that doctor because they're so busy with these other issues. Or it could mean the difference between having the money to pay for another doctor and relieve some of our shortage in the healthcare industry versus continuing to spend that money on sprains and broken ankles that maybe never had to happen in the first place. These statistics could literally be a matter of life and death for someone. And that's not all. My partner is going to need 8 or 9 weeks for her arm to heal. That means 8 or 9 weeks of lost productivity. So an employer is going to lose that productivity from their employee, and the market's going to lose that productivity. So that ends up costing quite a lot of dollars as well. And when you start to add up all of these externalities, that slack line that cost maybe a few $1,000s to install in a park might cost millions to taxpayers in New Zealand. Now, I'm not saying we need to get rid of the slack line. What I'm saying is, for a few $100s more, we probably should have put a crash pad next to the slack line, knowing that people always are going to fall off of it. And very few people make it across. That's what makes it a challenge. That's all it would have taken, is a small design change to still have the same amount of fun from an object without ending up costing, in this case, thousands of dollars for just my wife. And I would really like to see the statistics going into Whangarei Hospital if they've kept track of how many people have come in because they fell off the slack line. That would be interesting. Maybe it's nobody. Maybe she's the only unlucky one in all of New Zealand. But hey, it's worth keeping track of those metrics. I made this episode in part as a big thank you to New Zealand, and also a very big thank you to St. John's and the staff at Whangarei Hospital. Thank you for everything you did for us. It was top-notch service. We got great care, and we really appreciate everything you all do. But I also made this episode as a call for support. Right now, New Zealand is experiencing an unprecedented need for more doctors and more nurses. They call it a healthcare crisis, actually. And last year, healthcare workers went on strike to bring attention to how the system itself needs to improve. This wasn't about salaries or politics. This is about doctors and nurses saying they need help in order to provide the best care possible for New Zealand citizens. And it's our responsibility as voters in order to give that to them. If you're a Kiwi listening to this, I hope this gives you some perspective on how bad a system can be, like the one in the US, but also how great your system is and how fragile it can be. Please do everything in your power to continue to protect it. Encourage the government to build new hospitals and hire more staff. They'll tell you it's going to cost a lot of money, and you're going to say, yes, it will. And that's what we want, because it's worth every penny. Healthcare is not a nice to have. It's about who we are as a society. And right now, I'm proud of who we are and the healthcare we provide to each other. Let's work to do everything we can to make sure my family's experience at Whangarei Hospital is the norm for everyone entering a healthcare service in New Zealand. Let's do that together.
So what are you waiting for?
If you're thinking seriously about leaving America, especially if you want to move to New Zealand, check out our sponsor, VBI.NZ. That's NZ to us Americans. You can book an appointment with someone who can answer your questions about immigration and help you understand your strengths moving overseas. The link is in the show notes below. Please subscribe to the channel, leave me a comment, let me know what you think. Are you planning to leave America? What are your reasons? And where would you go? I want to hear about it. See you soon, or as we say in New Zealand, see you out there.